Bismillahirrahmanirrahim. Objective part of the SOAP notes. In the objective part of the SOAP notes, the doctor or the physical therapist examine and assess the patient. In the subjective part, the patient or the attendant or the relative of the patient has to speak and say about his patient disease, problems, etc., as we already discussed. But in the objective part now, the doctor is giving to perform some test and some assessment of the patient to reach to the assessment or the diagnosis of the patient. In this part, there are four main objects which are look, feel, move, and test, and they are also called as observation, palpation, movement, and special test. In the observation part of the objective, the doctor will check the observe. He will see the part of the patient affected. If it is a musculoskeletal problem, he will go and he will check the color of that part. If there is there any deformity, is there any swelling. So keeping in mind all these questions, he will observe the part carefully. After that, we come to the palpation and feel part. Feeling is done through the hand of the doctor, physical therapist, or the fingers of the physical therapist. So now he will feel with his hand the problem of the patient. In feeling, he will notice any spasm in patient's body. He will feel any swelling, any edema. It is pitting edema or non-pitting edema. So this will be covered in the palpation part of the feeling part of the objective examination. Then the doctor comes towards movement. Whenever he starts moving the patient, there are different types of movement. First of all, the doctor performs active movement over the patient and see if there is any loss or is there any decrease in the range of motion. Is there any decrease, loss in strength of the patient limb or body part. Then he perform a passive movement of that part, and whenever the therapist or the doctor checks the patient, he has to check it bilaterally. He has to check if the problem is in the right shoulder. The therapist or the doctor also check the left upper limb of the patient to compare both parts. He will compare both parts in bulk, which will be covered in the look part, but in the movement part, first of all, the active movements will be performed, in which range of motion and strength both can be checked. And after that, passive movement, passive range of motion is to be performed to check that is there any limitation in the passive movement of the patient. Along with the active and passive anatomical movements of the patient, there are some other movements called as physiological movements, and these are the movements of glide. In the movement of glide, the doctor check that is there any hypermobility or hypomobility, or the movement of the joint is of normal range. So this is to be this is the movement part of the physical examination of the patient, and after that we will proceed towards the special test. If a lot of things will be find out from the movement part, feel part, and look part, and these all are to be written on the examination in the examination note or the card of the patient. Now we will proceed towards the special test. There are a lot of tests given and demonstrated in various books and also in YouTube videos up on the internet. Therapists interested interested in examination, he should see those books, and it is compulsory that a physical therapist should be mastered in performing any type of special test. Every part of the body or any joint has its own special test. For example, in shoulder joint we perform the MTK test for the supraspinatus tendinitis, and the Hawkins-Kennedy test for the supraspinatus biceps tendon impingement. We also perform the speed test for the bicipital tendinitis. There are tests for the joint stability, anterior rod test, posterior rod test. All the tests are present in physical therapist books, and I know and I hope the students and the therapists, they may have seen those books, and they are aware, and they will be updating their knowledge by performing those tests. From these tests and all the objective process, a very good conclusion could be made that what problems the patient is having, and after this, when here the objective part of the examination of the musculoskeletal examinations will be nearly completed. But when we go for the neurological examination, in which the gait of the patient, the transverse activities of the patient, the ambulation of the patient, they are also very important, and they are also the part of the objective examination, but they are related to the neurological examination. In the neurological examination, as we didn't discuss here, the sensory examination and the motor examination. The same way, when we will go for the chest examination, there are other parameters which will be inshallah discussed somewhere else. But for musculoskeletal examination, the objective part of this examination is, I think, hope enough. I hope you will like my this demonstration. And if you get support from it, you also have to support us and like our video and share it and subscribe my channel. Thank you so much. We will meet in the next section of assessment, which is the third part of the SOAP notes. Thank you so much.